Oh yeah. So I'm open to any questions that anyone has. So if you have questions, let's ask them now. Let's get those questions answered. All right. Okay. So any questions, go ahead and ask, and Alan's going to help me field these questions. Because as you can see, I'm not the most adept at all this stuff.
So Denise says, yes, I have your book and I loved it and agree with your philosophy. I have numerous problems with short leg, now shoulder pain, and recently knee.
Okay. So Denise, did I hear it right that you think that you have a leg length discrepancy? That's what you've been told? Is that right?
Let me see
Short
if
leg,
I
is that what you
can,
mean?
I'll see if I can unmute her if she is here. Let me see. Ask to unmute. Did I click that? Yeah, so she should be. Okay, so Denise, you're typing, but if you want to unmute yourself, I think I just clicked the thing for you to be able to unmute.
I'm here now. Hi.
Hey, Denise.
Hi. Hi. Yes, I love your book. It really,
Thank
the philosophy is 100%. I ski moguls, and now I'm slowly not able to do that. Having too many complications from the lower leg led to scoliosis. But now I don't even know where to start. I mean, I will do everything you do here.
Yeah. Yeah. So, and did I hear right that you think that you've been told you have a leg length discrepancy?
Yes.
Okay. So, I'll tell you, I can count on one hand the number of true leg length discrepancies I've seen. And I'm going to get a skeleton. I'm going to show you that you probably don't have one. What you actually have is a side bending problem. And I'll be right back.
I do have a side bending problem based on what you just described.
So can you see this, Denise?
Yes.
All right. So here's the way a lot of people measure leg length discrepancy like this. They measure from the top of the pelvis to the bottom of the foot, right? And you saw in my image that often the top of the pelvis is higher in a side bending problem. That doesn't mean that the leg is longer though. It just means that the waist muscles are contracted. And so when you measure from the top of the pelvis to the bottom of the foot, or you look, I've even had people bring in full body x-rays that show this. See, there's my leg. No, that's not a leg length discrepancy. That's a side bending problem. And so measuring from the top of the pelvis to the bottom of the foot, we have 1, 2, 3 joints in that equation. Well, all those joints can go through rotation issues because of tight muscles or weak muscles, and therefore give the appearance of a difference in length. The way I measure leg length is from the top of the leg bone here to the bottom of the ankle bone down here. That gives us only one joint to contend with. And when I do that, I almost never see leg length discrepancies. And I just had one the other day. This woman came in wearing a lift in her shoe because she's been told by 3 different doctors, whoever, that she has a leg length discrepancy. She does not. She has a side bending problem. Okay. Fix the side bending problem, and miraculously, your legs will be the same length. And actually, this brings back a funny story. I did this little presentation where I brought up a woman who, she had a leg length discrepancy, she thought, and we fixed it. And, I showed everyone in the crowd what was going on, and lo and behold, everything's fixed. And then she was not very happy with me because she had this for so long. She had all of her clothes tailored to fit her leg differences. So she wasn't very happy with me, but it really blew everyone away. But anyway, so you mentioned scoliosis. So there's 2 types of scoliosis. One is congenital scoliosis that you're born with, and the other is functional scoliosis. So congenital scoliosis usually forms an S curve, kind of like this. We can change that S curve, or at least change the forces that are acting on that S curve by doing all the things that we do for regular side bending pattern changes. All right. So the scoliosis isn't necessarily indicative of the problem of what's going on here. It will contribute to that pelvis coming up. And so you might have to work a little bit harder if it's a congenital. Do you know whether it was a congenital scoliosis? Were you born with it, or were you diagnosed with it later in life?
It might have been a car accident, actually, but I've been going to chiropractors for 40 years.
Okay.
I have a lift as well, so I don't know. I just found out 5 years ago I had scoliosis.
Boy, I wish I could see you, Denise. I don't think you have true scoliosis. I think what you have is actually a side bending problem.
I
So
hope I can
this-
see you. I'm in
this-
Denver.
Pardon me?
I'm in Denver. I hope I can see you.
Okay, great. And if you can't get in to see me, I've trained all of my therapists in the same approach. So they get the miracles too. So they see everything that I do. But anyway, especially if this is a result of a motor vehicle accident. In fact, it's interesting. Okay. Even though because this has happened after a motor vehicle accident, it's likely you're in a trauma reflex pattern, right?
Mhm.
And so this is how Dr. Hanna describes the side bending problem. He actually calls it a trauma reflex pattern. So we're kind of getting away from something and we get locked there.
Yep.
And I'll tell you a really interesting story. I just had a woman this week, a gunshot wound. All right. And she came in like this, right? Her hip is up, her shoulder is up, and she was shot in her arm, this arm. But it didn't break her skin. It just grazed her skin. So she was stuck in this trauma pattern because of the gunshot, the trauma of the shot, not from any physical damage. So we've got to unravel that response. And that's probably what happened with you too, is you got caught in this trauma reflex pattern. And people see a pelvis up and a rib cage that's cattywampus, and they say, oh, that's scoliosis. Probably a functional scoliosis, not a congenital scoliosis. Does that make sense, Denise?
I agree with you 100%. I've never been convinced.
Yeah.
You're the first person though, you're the first person that said that. So it's brilliant. Brilliant.
Yeah. Okay. So give us a call if you want to, or download my program and that'll help you solve it too. All right.
Where do you start though, when you have so many multiple problems? So I see people's text here. I mean, we all have multiple problems. Where do you start with your books?
Well, that's why I created the downloadable program, because I didn't give guidance on where to start. The program does give that guidance. So, here's a little thing. If it was congenital scoliosis, here's a really interesting thing. If you have true scoliosis, the scoliosis actually is locking the spine into an extension problem. And it's the extension problem that's causing the pain, not the scoliosis.
Okay.
All right. So anyway, where to begin? So if I were to see you, well, first of all, I'd solve the side bending problem. And that's so easily solved. We can almost solve it right here. If you want to try and solve it right here, if you have someone to measure it, I can show you how to solve it right now.
Wow. Well, I feel bad taking all the time away from this here.
Yeah, Rick,
Okay.
we've got like 6 more questions in here too.
Okay, it would take 10 steps and we could probably solve that.
Oh,
But anyway, it's simpler than you think. And you bring up a really good point, because your chiropractors or whoever have been looking at you from a component standpoint, right? They're not looking from a systems standpoint.
Yep.
And that's why you're not better yet.
Yep. Yep.
Okay.
Okay. I'll buy the program and figure out some more things. Thank you.
Or come into our clinic, Denise.
Thank you.
Okay, anyone here can help you.
Thank you.
All right, Rick, I've got Lynn next. Lynn, I'll unmute you in just a moment. So she says, is how to use the body as the root cause, why perhaps doing lots of exercises to cure muscle imbalances only lasts a little while, haven't fixed how to use the body. Let me go ahead and find her here, and then I'll go ahead and unmute her. That was Lynn.
Lynn?
So let's see if I can, hold on one second. Let's scroll down. Okay, ask to unmute. Okay, Lynn, you should be able to unmute.
Hey, Lynn. Oh, something's going on
You
with your microphone, Lynn.
Yeah, I can't
hear you.
Uh-oh. She's at the top. Hold on. She's
Okay.
unmuted.
So, yeah, her mic isn't working. So, Alan, what was your question?
So let me read that back to you. So her question was, let me scroll back up here. Is how to use the body as the root cause, why perhaps doing lots of exercises to cure muscle imbalances only lasts a little while, haven't fixed how to use the body?
Yeah, I'm not sure I understand that, but I think what you're getting to is, yeah, if you're just doing specific exercises to fix muscle imbalances, that's another component theory. That's another component approach,
Right.
right? So, so fixing how you're using your body will often solve the muscle imbalances for you. All right. Does that make sense, Lynn? Okay. Did I answer your question? Okay. All
Yeah,
right.
I
Thank
think
you.
that's,
Thank
yeah.
you. All right.
All
Another
right.
one?
Now we've got Anne. So Anne, I'm going to unmute you in just a moment. So it says, I can't even stand or walk without a walker. How can I do your exercises? I already have all your books.
Yeah. So,
Let me
is Ann there?
Anne, I just clicked you to unmute. I think she should be able to speak if her mic's working. Anne, are you there? Do we
Okay.
see her?
Even if Ann isn't there, I'll answer her question.
Okay.
So here's, if you remember, I mentioned how comprehensive the program was. I haven't even talked about one big component of the program, which are the somatic audio lessons that I have there. So somatics is a way to decrease neurological tension in your body. And it's the way that you're going to learn about and break the neurological patterns that are locking your body into place. So that's where I probably start with Ann, is that the somatics stuff is the bonus. It's all in the bonus. It's not even part of the main program. Most people, go through the main program and that's all they need. But with Ann, because she's having a hard time even standing or walking, the somatics would be the perfect place for her to start, because it's all about lying down and doing these exercises to unlock the body and get it to move better. And the somatics, I can't tell you, I just had a conversation with the guy who just used the somatic lessons, and it was the thing that solved his numbness and tingling in his toes that he hadn't been able to get rid of for years. And because I can't say anything more than it just unlocks the body in particular patterns of movement. And all of them can be done lying down. They're very powerful. We use them all the time here in the clinic because a lot of people are so locked into their bodies. And with people who are resistant, we send them home with the somatic lessons and they start to unravel their body, and then we can start working with them. So Ann, that's where I would start with you. It's in the bonus section of the members area if you buy a program. I hope that answers your question. You'll love them. You'll love them. Everyone does.
Okay, so next we have Robin Singer. Robin says, will getting the discs and doing the work you suggest help me stop going to PTs and chiropractors?
I sure hope so. That's the whole point, Robin, is that, I'm trying to put the power back into you. And one of the nice things about the program is that, I also didn't mention this, is that there's a video on there that explains in more detail how all of this creates pain and how to unravel it. So once you can wrap your mind around exactly why you're having that pain, and my exercises will take you through this and unravel all of these things, the taping, the ergonomics and all the other things that I have in there. My goal is for you not to ever have to go back to physical therapy, chiropractor, doctor again for this issue. All right. It's the way it worked here in my clinic, and I've tried to make this program as close to my clinic experience as possible. Same patterns of exercises, same sequences, same taping techniques, everything. And you saw also, Robin, that those testimonials from the people who just read my book and were able to solve their pain. This is even better. It has even more stuff. So I really think that this will have the solution for you and get you where you need to go. I truly do. I wouldn't be here talking about it if I didn't. I really think it's a huge game changer in terms of how we see pain and solve pain.
Okay. And next we have Steve Waite. Steve says, I used to love golfing. Will there be exercises to get me to return to playing?
Well, yeah. So I'm assuming, Steve, you're having back pain. Golfers typically have a side bending problem going on with their body because of the way that you have to swing that club. I mean, I see golfers all the time in the clinic. We always get them back to golf. If I can only say, probably yes, because the same, like I said, told Robin, the same solutions that we use in the clinic are in this downloadable program. I just edited them down, made them more concentrated. And if you just follow it through, you'll solve your pain. And this is the other thing I mentioned there. I've broken the program down into two phases. The first phase is pain reduction. You stay in pain reduction until you're 75% better out of pain. And then you move into the strengthening program. That's the strengthening phase is about getting you back to life, sports, and all that kind of stuff. But if we try and get you right back to sports right off the bat without solving the problems and you understanding the problems, it just doesn't work well like that. That's why I've broken it down like this and kind of given you that 75% criteria. All right. And that's all in your hands about how you're judging your pain. So I believe, yes, it should get you back to golf by all means.
Thank you.
Yeah. Oh, hey, Steve.
Yes, thank you.
Yeah, my pleasure. Is there any more things specific you wanted to say about that, Steve, or no?
Oh, hold on. I think I muted him back. Hold on one
Okay.
second. There he is. He should be back. I don't think he
Yeah.
had anything else to say.
No, just willing to do the work like I've done before. It just wasn't the correct way, I think.
Yes. Yeah. And this is, I'm glad you said that you're willing to do the work because everyone is willing to do the work. And, so often, a therapist or someone will say, they don't really want to get better. Everyone wants to get better. We just haven't had the right solution. And I really think that, seriously, I wouldn't be on here if I didn't think that this had it for you, because it's had it for 10 years for nearly everyone in my clinic. I really think this will solve it. And if you have the desire to fix yourself and think about what you're doing, you can solve this.
Oh, it's there. Thank you.
Yeah, my pleasure, Steve. Thanks for being here.
Good. All right. So next I have Jada. Jada says, I've had back pain since age 13, and I had a teleconference with you in July, but my hip pain hasn't gone away permanently. I'm thinking maybe I should try starting with the back first. So let me go ahead and unmute her. There we go. Okay, she should be able to speak in just a moment. There you go. Jada, you there?
Jada?
Yes, I'm here.
Hi, Jada.
Hi.
How you doing?
A little bit of pain in the hip and rear
Yeah.
area still.
Yeah. Can you can I see you? Because I think I remember who you are, but if I saw you, I'd know for sure.
Hang on one second.
All right.
Okay.
There you are. Okay.
Okay.
Yes. That's who I was thinking of. All right. So you've got that hip pain.
Yes. Still.
All right. So I think I gave you that butt strengthening exercise, right?
Yes, you gave me those, and I did the ones that I did outside, walking on my tiptoes and leaning forward and all those things. That
Now, were you able to activate your butt well? Do you feel?
not very well.
Okay. This is the problem, I think. So this is something I haven't talked about tonight, but I think we talked about it with you, is that I believe that you have a tracking problem in your hip joint,
Yes.
right? This
Yes.
is likely what's causing the pain. And it doesn't go away until that tracking problem is solved, because your bone is hitting a place in your hip joint that it shouldn't be.
Correct.
So we haven't been able to solve the butt activation aspect of this. Sounds like.
Yes. Yes.
Right? Okay. All right. All right. So if what I've given you hasn't solved the butt activation aspect of this, and you haven't had luck with that, have you been to someone like a personal trainer to focus just on the gluteal, like squeezing the gluteals and getting those gluteals to turn on?
No.
Okay. I think what you probably need, Jada, because I think you have a more serious problem of actually getting your brain to connect to that butt area. And so
Yes.
I think you need someone's individual attention, like right there, telling you it's on. Okay, now hold it there. It's off. And I think it would be worth your while just to have one session with a personal trainer or physical therapist or chiropractor or whoever, massage therapist, someone to be right there who understands what that means to turn that glute on for you, and then go deeper into that solution. Because I think that is the problem. I believe that you have a tracking issue with that hip.
Yes, I think so. And I know what we described earlier, it felt like I have more of a side bending with rotated spine problem.
Yes. Yes.
And so I didn't know if the back
Is causing the hip.
would help.
Yeah. The back pain program will help you with that. But what I usually see, Jada, if your primary concern is the hip,
Yes.
I mean, I've got a hip pain program. You can get that instead of the back pain. I usually see the hip causing the back issues, not the back causing the hip issues.
Okay.
All right. Because if you remember that, if you watch the video where you saw that uneven pelvis,
Right.
Okay. The pelvis is uneven. It's higher on that one side because it's trying to get off of something painful on that side.
Right.
And so those waist muscles then contract to lift that up. That's what screws up the back.
Okay.
So we solve that leg issue that's causing the hip to become elevated. That's what will solve that side bending. And usually it's the hip joint that's the problem.
Okay.
So I would focus maybe on, if you're going to get any of the programs, I would focus on the hip pain program.
Okay.
But if you're having a really hard time understanding, getting this butt to turn on and understanding that it is turned on, you might need someone's individual focus right on your butt. Their eyes should be right there, and their hand should be right on that butt. And I think you might need a little bit of extra tactile help to get that butt to turn on.
Yes.
All right. But in that hip pain program, I have did I show you a mobilization technique? How to pull that femur head back in the hip socket with a strap?
No.
Okay, well that's in the hip pain program too.
Okay.
And what that does, I show you a technique to use a strap to pull the femur head back in the hip socket, and that usually helps a lot of people too.
Okay.
And that gets at least the femur head back where it should be, even if your butt can't hold it there for a period of time. And that might give you a window of saying, oh, my hip feels a lot better when I do that exercise. Okay, then that confirms that we're having a tracking issue, and I've got to get my butt to get going somehow.
Okay.
Does that make sense?
Yes. Uh-huh.
Okay.
Okay, good deal.
All right. Thanks, Jada.
Okay, thank you.
Good to see you, or
You
see your
too.
hand anyway.
Yeah. I know. I'm not good with this stuff either.
All right.
All right, good. So I got, so I gave Jada the other link so that she can buy the hip pain program with that different little link that we have here. So that's fine.
Great.
The next person I have here is Dennis. Dennis says, my back pain resulted in weakness in right foot door flexors with tingling around the big toe and top of foot. Where do you think I should start? I do not have back pain, just weakness and tingling. Let me see if I can find Dennis here. Dennis, I will ask Dennis to unmute, and he should be able to talk in just a moment here.
Okay.
There you go.
Hey, Dennis. Thank you for being here.
Hey, Rick.
Good to see you.
Thank you.
Yeah. So you've got some lingering weakness in that area and pain and tingling in the foot. Is that correct?
Yeah, it happened in July. And I went for therapy, and what he said was it's a long way from the back down to the foot where or to the leg where the muscle is. And he thinks that I basically have to wait until the nerve heals, because he said I had like, I don't know, poor minus, fair minus strength, he said.
Yeah.
In the dorsiflexors.
Mm-hmm.
And so I wasn't sure which approach,
So Dennis, do you know why this happened?
I think it was from trauma. I did a lot of heavy lifting of logs, putting them on a splitter, and I think over time it just did something to the disc. And
Mhm. And it's just in the right leg, right?
yep, just one
Okay.
leg.
Do you think you have a side bending problem?
I'm not sure.
Do you have someone who can take a picture of your back later and check that out?
Yeah,
Okay, I would check that out. I'm going to guess you have a right side bending problem and you have compression on your right side of your spine,
right.
and you will need to open that up
And-
because if that could be one of the things that's contributing to the slowness of the recovery.
Right. Okay.
All right. And in that back pain program, I show you a couple ways to do that. It's really easy to do.
Okay.
But if your therapist has graded that as a 2- or something like that in your foot, that's a
Yep.
fairly significant weakness. All
Right.
right. And so what I do in these cases, do you need to wear do you have to wear an AFO? Do you have, okay,
I tried one, but I was better without it.
you're better without it. Okay. So
Yeah.
what I would do with you is focus on your gait mechanics, because right now your gait, the way you're walking, is
Mhm.
contributing, I think, probably to compression on that right side of your spine.
Okay.
Because I bet you that you're collapsing a little bit on that right side.
Yep.
And
Yep.
so we need to solve that in order to unload the pressure from the nerve roots feeding that sciatic nerve down your leg.
Right.
Does that make sense?
Yep.
And I show you how to do that in the video too.
Okay. Because I have the back and sciatic pain already. I haven't looked at it, but I have it.
Oh, the program?
Yeah.
Okay, great. So
And-
the reaching while walking
Yeah.
one
Okay.
will solve the rib cage compression issue on your
Okay.
nerve roots. All right. And it'll get your hip to work better too.
Now, because I have the DVD, am I also able to watch it online?
Oh yeah.
And I'm just curious, how do I do that? Is there a special way?
Well, you should have received a link when you purchased it.
Okay.
Right, Alan? Are you there, Alan?
Yes, I'm here. If you send me your email address, I'll be able to look you up in our system, and I might be able to get you that link out to you like tomorrow or something.
What's the email I should send it to?
Send it to support@rickolderman.com.
Okay. Thank you.
Oh, sure. And Dennis, you can also download any portion of that program onto your computer so you don't have to go back online too.
Oh, okay. Okay.
All right. And I'll tell you what, I would also check out, if you remember hearing me talk about the somatics lessons,
Mm-hmm.
I would check out the somatics lessons for yourself as well, especially number 5, which is for hips,
Yeah.
to see how that leg functions. And then number 8 is for walking.
Because part of your program is based on Hannah's work, is that right?
Yes. Mhm.
Because I met 2 teachers from Colorado years ago who trained with him. And I watched one of those videos where he was interviewed by, I forget, somebody, and it was fascinating hear him talk.
He's an amazing guy.
Yeah.
Yeah.
Yep.
Yeah. So I would try the somatics lessons that I've recorded
Okay.
and see if that helps you neurologically connect to this area of your body again.
Okay. Appreciate it.
Oh, sure.
Hey, Dennis, real quick, I think I found you in the system. It'll still take me to tomorrow to get you the link, but it's I have your email address here. I won't say it publicly, but I have you in the system, and it shows that you purchased a bundle. So I'll be
Yep.
sure to send you out that link in the next 12 to 24 hours for sure.
All right. All right. Thanks.
All right, no problem.
Glad you were here, Dennis. Thank you.
Yeah. Thanks.
Good. So let's see, who do we have next? Let's see. I think this is the last one. John. So John says, I have left-sided weakness because of a stroke 5 years ago. Can my back pain be fixed with this weakness and my side bending problem? I also have a lot of arthritis and had many joint replacements, 2 hips, 2 shoulders, and 1 knee.
I know which John this is. Is this John P?
Yes, let me grab John here. Oh, John might already be unmuted. Well, let's see, I can share video. I see him down here. John, you should be able to unmute if you want to speak. I'm trying to unmute you, but I don't know. Maybe he can speak,
Okay.
maybe he can.
Okay. So John, I'm going to go over because I remember you because you came into the clinic and I've worked with you a couple of times. And so if you remember, because of your stroke, you've lost control of that leg, right? And when you stand and walk, that knee is snapping out to the outside. That's the thing that we have to get under control in order to control the leg and control your pelvis and back. It's your back is responding to the snapping of that knee. We talked about, I think, let's see, I can't remember. I know that we discussed this, but what's happening is your knee is snapping backwards into the outside, which is then jutting the hip and causing the side bending issue. I believe the problem is that knee seems to be the trigger. So, getting like a knee brace to block that knee from hyperextending might be an interesting solution because you don't have the motor control to control that leg well, or at least that knee. I don't know if that makes sense.
I think that answers it. I mean, he's
Okay.
not speaking at the moment.
All right.
All right, and then this will be the last question, which is actually a great wrap-up question. This person
All right.
is I don't know what the name is, but it says, can you describe the DVD and the home exercise program in more detail?
Yeah, if they're there, if they have specific questions, I'll be happy to answer them. But basically, so if you go to the members area, you'll see that there's a video about how this works. And I kind of take you through not only how the whole program fits together, including all of the parts of it, but there's another video about explaining the primary causes of pain and dysfunction. And so that kind of, because I want people to understand why they're doing what they're doing in the program. And then you go immediately, there's a pain disability index questionnaire too. And what I'm trying to get people to do is fill out the pain disability index, which gives us an objective number of their pain right now. And then they're going to fill it out either at the end of the program or at the end of the week or whatever they want to do. But that is an objective measurement of the pain. I'm trying to show objectively that this program works, so I can take it to other practitioners, insurance companies, or whatever, to say, hey, this program in 1 week, most people reduce their pain by X%. But anyway, you can fill out the pain disability index to get an objective measure. After you do that, then you start with the pain reduction program. That's the program that focuses on reducing your pain. There's a couple warm-up exercises. There's about 7 exercises there that you do. They're very gentle. I show you how to modify them. And then that first set takes a little while to go through because I'm teaching you. But you'll see that there's a second set video there. And that's all those same exercises without me going through all the explanations. You just follow me along now that you know how to do it. So it goes a lot faster. Usually that whole pain reduction program will take about 15 to 20 minutes to do. And we'll do them for 2 sets, once or twice a day. The more, the better. Okay. Once you're 75% better, then you move on to the strengthening program. And again, the first set is me showing you how to do everything. The second set is faster. Once you know how to do it, then you can just jump in and follow me. And that's getting you stronger for getting back to life, sports, exercise, work, whatever that is. Okay. That's basically the program, but I also have an extra help section, and that's where I have taping techniques that to help tape your body, because a lot of people can't control their body the way they need to right off the bat. So the tape bridges that control. It gives you the control so that you can get out of pain faster. And then as your body gets better control, you can tape less and less and less. So you'll wean yourself from the tape eventually. In that same area, I also have the ergonomics. I teach how to walk better, how to walk, all sorts of extra stuff about changing how you're using your body so that, because it's those habits that are causing most of the pain. All right. So those I don't consider as exercises because they're about changing how you do something. So you should be thinking about walking better every time you walk, or you should be thinking about the ergonomics every time you sit. It's not an exercise. It's something that you'll just adapt to and start using for the rest of your life.
Hey, Rick, you know what? If you can stop sharing your screen, I'll share mine because I've got the program open.
Okay,
and then
great.
You can speak to that.
All right, super. Thank you.
No problem. So let me do this and then I'll come in here. And here's can you see my screen?
Yeah, I can.
Okay, yeah. So this is what we got here. So this
Okay.
is the back pain. And you just
Yeah,
tell me
so
where to
there's-
click and I'll click.
Yeah, there you go. So yeah, click on the back one.
Mhm.
And so we talked about watch this first, that walks you through the whole thing. Introduction, all right, is explaining, what the problems are. There's pain reduction first set, pain reduction second set, just like I explained. Restoration and strength first set, restoration and strength second set, just like I explained, to get you stronger. Changing habits, that's a big part of the program, is it's all the things that typically cause people to have pain and have this dysfunction. So you want to change those habits. The extra help is where all the taping and practitioner stuff is. All right, to if you need extra help, if you need to use tape, or if you need to have a practitioner help you with something, those recommendations are there. They're the techniques I use in my clinic to help expedite healing. All right. Then we have a pain reduction exercise checklist, which is just the checklist of the exercises. All right. A lot of people lose track of which days they've done it, how often they've done it. So this is just a checklist to keep you honest. All right. And then the restoration exercise checklist, same thing. These are the strengthening exercises after you're done with your pain reduction phase to help just keep you honest. Overall pain checklist. This is one that allows you to start thinking like a therapist. It asks you questions like, hey, which ones were hardest for me? Which ones did I do the poorest at? Which ones have I seen the most progress with? Which ones do I think I'm doing are helping me the most? So this checklist is pretty important because they're the kind of questions I would be asking you. So you can ask yourself that and hopefully arrive at the conclusion that, oh, you know what? These exercises are really helping me. This one specific exercise is the one I think I need to be focusing on. That's what that's about. Okay, and then we go into the bonus. So here's the bonus somatic stuff that I was talking about. So this is, I think, Alan, if you can scroll down again. That's the video, right?
Yes.
Yeah,
Part one
so
and
I
part
have
two.
2 bonus back and sciatic pain videos. And these are videos I've created that combine both the biomechanics of Dr. Shirley Sarman with the neurological stuff of Hannah Somatics. So I've combined both of them into these 2 videos that a lot of people get help from. There's part 1 and part 2. Okay. And then at the very bottom of all of this, I think, is this audio somatics.
Yes, that's this.
Yeah,
part
there we
here.
go. So there are the 8 somatic audio lessons. You can download all of these onto your computer if you want to, but you can just listen to them and they will take you through. They're all different patterns of movement of the body that typically cause pain. And so these movements are really key to unlocking these patterns of movement. This is the nuts and bolts of somatics. All right. It's a biggie for a lot of
Yep.
people. And then
And
there's the
the
pain disability test that I was mentioned before. You take this test. It's like 11 questions or 10 questions or something. And then we get an objective idea of what your pain level is. Okay, today my pain level is overall whatever, it'll give you a score. And at the end of this week, oh, wow, I didn't realize, wow, it's down by 20 points. I can't believe it. I didn't realize I was doing that good. Because a lot of people forget, this is what I found in the clinic, a lot of people forget how much pain they were in when they began. And often we have to remind them, no, you couldn't do that when you came here. And so that's the pain disability index, is just keeping us honest about, are we truly getting better or not?
And
I
that-
want to know, and hopefully you want to know too.
Yeah, and that ties into the overall pain checklist because it asks you for your score there as well. So
Yeah,
if you were
it
to
does
come
ask you
back
for the
into
score.
that, you can see.
on that
Yeah.
pain checklist right at the bottom there.
Right here.
All right. So you don't have to fill out the checklists. They're just there to keep you honest. It's like me nagging you. All right. Okay. So hopefully that answers that kind of gives you a glimpse as to what's in this, what it's all about, and whether you think it's worth the trouble.
Right.
All right. I want to thank everyone for coming tonight. This ended up being a little bit longer than I had anticipated, but I hope you learned something. And my greatest hope is that you now have hope that you can do something to solve your pain. I really think that you can. And I think my program can help you quite a bit, if not significantly reduce it, completely eliminate it altogether. So thank you for coming.